When you see a medical professional, you want to be seen, you want to be heard. Most importantly, you want to be helped. But that's not always the case. More and more patients are expressing their frustration with medical gaslighting. But what does that term even mean?
And I think to myself,
you're gonna look at me and you're gonna tell me that I'm wrong? Am I wrong?
So jet lagged from Australia?
You are? Why?
Because I just came back from Australia.
I asked myself if I'm crazy, and we all said no. So.
HappiMoto. HappiMoto.
HappiMoto.
Gaslighting is a form of psychological manipulation and abuse by a person or group that makes someone question their sanity, perception of reality, and even their memories.
Has anybody in the last couple weeks looked at you and said, it'll be fine if we get COVID because Omicron is really mild, but I don't want to have a mild sickness? When we say mild COVID, we mean short of hospitalization and or death.
People who are experiencing gaslighting often feel anxious and confused, unable to trust themselves. And that happens a lot with people who don't feel well.
A lot of people get really defensive when I say I don't like doctors because they're somehow held to this standard in society where people just trust them blindly. There are a lot of doctors who have a God complex. They think they know more about your body than you do.
Unable to trust the body's experiences, feeling anxious and confused, unable to find a solution, not knowing what's going on with the body. So medical gaslighting is when a medical professional blames a patient's symptoms on mental stress.
I'm getting ripped tonight. RIP that. But your tests are all normal. I think it's just anxiety. You're just thinking about it too much. Have you tried losing weight? You look great.
Hormones, distress, anxiety.
Is this a prank? Because I swear to
It is no prank, bitch.
Hey!
Or dismissing it entirely.
We're all being gaslit into thinking that that is what will solve the problem.
It's really not that bad. Are you sure that's what you experience?
They will gaslight you, tell you you're crazy, and that your symptoms aren't real. The first doctor I went to refused to test me. She did blood work, said my red blood cells were enlarged, and told me to stop drinking alcohol, which I didn't even do at the time. I finally got a positive diagnosis of Lyme and Babesia, which causes enlarged red blood cells. I told her this and she told me it was a false positive.
But sometimes that's the case, you may say. Is gaslighting always bad? Well, yes, psychologists agree that gaslighting is very bad, and most medical professionals agree it's a problem in the industry. Medical gaslighting can lead to misdiagnosis. So why do doctors gaslight? Well, it's easy to assume that they have a God complex.
Doctors are the most gaslight, girl boss, gatekeep people that anyone ever has to interact with, and I mean that 100% seriously. For example, so yeah, I've been having these symptoms lately where like I can't stop passing out, I have to sneeze constantly, my head hurts, and whenever I pee, there's just like a lot of blood. No, that's not true. You're lying. Well, if you don't believe me, can't you at least run some tests to see if there's anything wrong with me? No, actually, I hate you. Why am I even here then? To give me money. Wow, I'm the best doctor. I just love helping people.
When looking at the doctor-patient relationship, it's asymmetrical. Patients come to doctors because they need help and the doctor has the solution. It is a customer to provider experience. The dependent on assistance is a one-way path, often with the doctor in a position of power. And it's easy for doctors to feel powerful. The role of physician requires one to be knowledgeable and have knowledge. Most doctors are most knowledgeable in medicine and mostly only knowledgeable in medicine. It's a topic that they're engaged with speaking about all the time at work. And knowing something feels powerful. Confidently giving answers feels good. And at times this is high stakes knowledge. Medicine deals with human suffering, life and death. So it's hard to avoid the importance of knowing this knowledge and communicating it. So when someone feels knowledgeable and important, obviously important is life and death, then put into a power dominant position, yeah, they're gonna have big egos and God complexes. It's not surprising. It's easy to feel knowledgeable or important when most of your life functions around one subject.
Making fun of your patients because they were forced to Google something due to the incompetence of the medical system isn't funny. And it's a reality that most chronically ill and disabled people have faced. It took me having to do research and being like, whoa, This does not make sense or match my symptoms. It took me having to go on WebMD to prove how much of an idiot he was. The fact of the matter is, doctors are incompetent. Doctors are idiots, and you can't convince me otherwise. Doctors are stupid as hell, and they have the biggest egos ever. Listen to your patients and try to help them out. It's not a joking matter.
But it's not like these doctors got the knowledge all by themselves. They owe their knowledge to generations of global collaboration. This is not just a personal IQ thing. Doctors are not these great inventors. They are not changing the culture of society. Nothing that they do is unique or special. So you think that would help with the God complex. But people who thrive on having power and authority over others, especially those who thrive on having more knowledge, will likely have a God complex or a big ego. So what do you do about gaslighting? First, you have to recognize it. Does your doctor make your symptoms seem like character flaws?
What is the most unprofessional thing a doctor has ever said to you?
So I've experienced medical gaslighting all my life. I have endometriosis, so as you can imagine, I've been through it. However, in 10th grade, I suddenly came down with this really mysterious illness. I'm already a pretty thin person, and this caused me to drop a lot of weight. And my fucking doctor swore to God that it was an eating disorder. After dropping nearly 20 pounds, and the doctor looks at me and goes, "You feel like you could eat a cheeseburger?"
Do they say you're overreacting? Do they say that you make up symptoms? Do they claim your emotions are excessive? Do they want to have authoritative control over your healthcare? Do you feel more anxious about your health after a doctor visit? Do you feel like you're being too sensitive after a doctor visit? Do you feel like your health problem or issue is your fault? Do they claim you have symptoms that you never said you had? Do they deflect your current experience on past events? Do they change topics when you're talking about a specific issue?
Well, I guess I don't need to go to therapy. The problem seems to have resolved itself. Are you sure about that? I said it resolved itself.
Do they often have to reassure you that they're there to help? Or does your doctor blame all of your health conditions on one aspect of your lifestyle? You might be experiencing medical gaslighting.
1-800-GASLIGHT.
It's not the end of the world. You can still get good medical care.
Things healthcare providers shouldn't say to people with chronic pain, part 2. I don't think things are really severe enough for you to have to see a specialist. Well, if you don't want surgery or injections, then there's nothing else I can do for you. I don't think you're drinking enough water. You really need to work on your posture. You're gonna have to lose weight if you want that pain to go away. Well, you know, if you exercise, that would help. Have you tried to control your anxiety? How many painkillers did you say you're taking? I'm gonna recommend Tylenol and bed rest. You must be high with all that medication you're on. Well, there's nothing wrong with you physically.
First step, identify medical gaslighting. If your doctor is gaslighting you, get a new doctor. It's not worth the effort to try to work with them. So you have a new doctor, and we want to vet this gaslighting as soon as possible so you don't have to get a new physician. Before you go to the first visit, identify all of your symptoms and write them down. Evaluate how those symptoms are affecting your quality of life. Be honest. If possible, show up with proof of these symptoms with videos, photos, or recordings. Educate yourself. It's always important to work with a medical professional on your healthcare, but it is beneficial to self-assess your symptoms and possible conditions beforehand. You might find you have a symptom that you were denying yourself. You might find a symptom that you yourself were dismissing or denying. It's okay to go online and speculate about your diagnosis. If your doctor has a problem with you bringing a WebMD article in, not the right person for you. They don't want you to have control over your health. When you're speaking with a doctor, make sure they don't veer off the subject. And if they do, bring them back on track. I know you want to resolve that problem, but I want to resolve this problem first. And manage your expectations. While doctors have tons of knowledge, they are not perfect. They don't have cutting edge knowledge or tools. They are medical professionals with likely dated knowledge and a lot of experience. They cannot immediately identify what is wrong without investigation. It is likely that the first visit will bring no results. Don't be afraid to end the conversation or stop working with a doctor. If you are in an office visit and you feel like they're dismissing you, you can end the doctor's visit right there and walk out.
All you ever did was do me wrong. So I hope you go broke. And your phone breaks and your ex shows up for your next birthday.
Remember the dynamics of the situation. You are the customer. They're there to help you. If you feel stressed out or anxious when working with a doctor, walk away. It's okay. But the most important tip I can give if you're working with a doctor who keeps gaslighting you, ask for the differential diagnosis. What does that mean? It's a common term that all doctors know. It means, I know you think this is the diagnosis. What's your second guess? If they get offended asking that question, again, there's probably a God complex there. And remember, gaslighting is both subconscious and conscious. There are patients out there who do make up symptoms, and there are patients who argue with doctors on what is the best medical care. But that is a minority of people. And ultimately, only you are in control of your health. It doesn't matter what doctor you visit, what medication you take, what you do to stay healthy. The only person responsible for your health is you. So don't be afraid to take responsibility for your health, even if it offends a doctor with a God complex.
That's the stupidest thing I've ever heard. That is the stupidest fucking thing I've ever heard. I have never heard someone say so many wrong things, one after the other, consecutively in a row.
Thanks for watching this video. I hope it was informative. If you like this content, please check out my other videos. I have a cool Jake Paul video about dehydration and a new video out about the metaverse. Please subscribe so other people can find this content, and let me know what you think in the comments. I would love to hear about any experiences with medical gaslighting. Thanks for watching.